Hello, I'm Sarah Marbury, Executive Vice President and Chief Operating Officer at the Center for Health Design. And I'm here today recording this interview with Andy Corr, who is an award-winning lecturer, author, television host, and expert in human performance and motivation. With a master's degree in the science of human performance, Andy has spent the last 17 years mastering what it takes to become energized, healthy, motivated, and better equipped to thrive in today's hectic society. He's with me today to talk about his core principles and his upcoming appearance at our Healthcare Design Conference in Nashville. Hi, Andy. How are you today?
I'm great. It's great to be on the call with you, Sarah.
Well, Andy, can you give us a brief overview of what these core principles are that you're going to talk about at the conference in Nashville?
Oh, absolutely. I'm really excited. Anytime I get asked to speak, if it's a group that can have an impact in healthcare, then I'm on board because that fits my mission of helping people who work in and around healthcare help others. I think that's one of the biggest ways we can make a pretty significant difference. And those that work in and around healthcare and in healthcare design are plagued with the same barriers, the same issues, the work-life balance issues that we're all faced with, if not more so than the general public. So I typically help people with my core four areas are simply energy. Number one, do you have the mental and physical juice to sustain high-level performance, deal with that you've got going on at work and in home, your personal life? Do you have the energy to sustain that without undue stress and wear and tear? Be at your best. I also talk to people about support. Do the right people have your back? Are your friends and family and your coworkers part of the solution, or are they part of the problem? And then I talk about skill. I mean, living a healthy way of life, a highly productive way of life, a balanced way of life, tapping into your creativity. Those are all skills that can be learned. So I not only tell people, of course, what they know they should be doing, but I take it down to more of a practical level, a tactical level. How can these positive changes, these work-life balance ideas, these personal processes, how can they realistically and meaningfully fit into a busy person's life? And then that tags into the fourth principle is, I call it momentum, but it's based on the science of behavioral momentum. And it's simply that human beings are pattern-based beings. We live and die by our routines. Researchers from the U.S. Olympic Training Center believe that 9 out of 10 of our daily choices are simply based on our patterns, on our daily routines, not a logical, weighed-out choice, or even a choice where you're sitting there and thinking, well, this fits my core values, I'm going to do X. It's basically we get swept along of the patterns that we build or let others build into our day. So this, I know, is an area that's going to speak well to this audience because I'm sure they're thinking often about human behavior patterns and how their environmental and interior design structure, the architecture, all those things are implemented to influence positively human behavior in the healthcare environment. So I'm going to help them with some best practices along that line from an outside in, an external viewpoint, but also from an inside out viewpoint, because I come from the world of human performance and what drives optimal human performance from the inside out. I hope that wasn't too much information for the first question.
No, I think that's great. Well, I read that you mentioned in one of your core principles that exceptional companies invest in their people's life in and out of the office. So what are some of the ways that companies can do that?
This is a topic that's becoming more and more, I guess, talked about in the corporate and healthcare environments. For instance, employee engagement is the huge buzzword and has been and will continue to be for the years to come. Because if you can drive greater levels of engagement in healthcare facility employees or in your own workforce or better engagement with the people in your personal life, those things drive a better life, a more productive life. So what really truly gets people engaged? Well, I'm doing a lot of work with Intel right now. They're really focused on what they're calling a Great Place to Work program. And basically it's based upon the principle of, I'll give our listeners a quiz. All right, here's the question. What do you think gets people more excited about doing their best at work? A, money. Is money the primary motivator? B, career advancement. Does that motivate people to do their best at work? C, direct relationship with manager. If it's good, they're really engaged. If it's not, they're really disengaged. Or is it D, feeling that the supervisor level has a sincere interest in their well-being? Okay, for years I thought it would be, A or B, money or career advancement. But Gallup Healthways did a survey of 140,000 working individuals, and it was D all day long, feeling that people have a sincere interest in your well-being. And so I believe that when we look forward to what's going to increase employee engagement, whether it be, if you define engagement as the willingness to do their best or to be invested in a process or a cause or a family, I think it all has to come back to, do they believe that you're coming from a place, a heartfelt place, a sincere interest in the well-being of the people who you work for and work with?
Hey, we all want to be loved, right? I mean, that makes perfect sense to me.
It does to me too, and I think that's the great way to say it. It's I am a quote motivational speaker, so I didn't want to say it comes from the heart. It comes from love, but that's really where it comes from. So for me, it sounds simple when you say it like that and when you get the data like that, but it's real easy to get caught up into the day-to-day grind of our current work culture and lose sight of it and think that it's about money and career advancement. While those are super critical, if we lose sight of this humanistic approach, I really think that's where our work culture is going, and especially what I've seen in most of the successful companies and healthcare facilities that I've worked with and foundations. They have to come from a place of the heart, and when you do that, you get people really, truly engaged from a heart level, and the heart goes to the brain. It's the closest path from A to B.